Good afternoon. My name's Paula Rabideau, and I'm going to be sharing a brief look at the accomplishments and activities of knowledge translation during year 3. First, I'd like to outline what our project outcomes are. We have 4 primary outcomes. First is to improve the ability of adults with IDD to advocate for themselves in health research. Second is to establish the prevalence of people with IDD and co-occurring mental health conditions. Third, to develop a better understanding of health outcomes in adults with IDD who have co-occurring mental health conditions. And lastly, to establish psychotherapy guidelines to advance mental health treatment for adults with IDD. Now, these outcomes are project outcomes for the whole 5 years of the grant. Some of the products that, again, we expect from these whole 5 years are to develop new cognitively accessible, reliable, and valid health measures for adults with IDD, to develop guidelines on providing mental health care for adults with IDD, and to develop peer-reviewed publications, policy briefs, cognitively accessible data briefs, conference presentations, and training webinars. So I'm going to summarize the status of peer-reviewed papers to date. As you see, we have a number of papers. We've all been involved in several of them, I'm sure. We have 8 papers drafted, 3 published, 2 accepted for publication, and 1 being resubmitted for reconsideration. So the team has been very, very busy. COVID has certainly restricted our presentations far and beyond what we had hoped. But the team, including Susan, Jean, Chelsea, Jill, John, Chris Sanford, all were able to present at the AIDD conference on using technology to understand mental health from the perspective of adults with ID. So kudos for going out and doing above and beyond. The Deep and Andrew Buck and Chelsea have been actively involved in finalizing the easy read publication guidelines that will guide us through a peer-reviewed product that is accepted and has been published to an easy read version of the product. So it's a 4-step process that's been developed, starting with identifying the audience and the product type, and then working through a series of KT templates that allow us to interact with the Deep and to get feedback back and forth between authors and the Deep regarding our publications and our outputs, until finally we have a published product that is finalized and meets the needs of clear publication guidelines. Our mental health collaborative has been struggling somewhat over the last, I would say, nine months or so. Our momentum has been interrupted, so we don't seem to have the engagement that we had earlier in the project. So the plan is to reorganize through a survey that we'll send out to the participants, asking to get some feedback about what the needs and opportunities may be around this topic area, and see how we can re-energize the mental health collaborative in the near future. Plans for year 4 are mainly focused on completing study 2, the prevalence study. We'll also be taking that easy read publication guideline and applying it to paper number 9, straight from the horse's mouth, increasing self-report and mental health assessment in people with intellectual disability. Work on publications will continue, and I'm sure the number of presentations will uptick. Thank you. That's it for KT.